Okay, good morning to all of you. So today we are discussing our topic. The next point is there the concept of active principle and the major metabolic pathway of the carbohydrates leading to the production of therapeutically active chemical constituents. So here for our study the carbohydrate and the proteins, these two pathways are there. So basically I think we are knowing in the nutrition. So while we are define this, so it is the science how the body utilize the food to meet the requirements for the development, growth, repair and the maintenance. So it is very important that for the our development of the body generally need of the certain nutrition or the food is important. So here you are observing a small child, generally he needs a certain amount of the food. So if anybody we ask how you are grown up, so it is impossible to say that. So therefore the carbohydrates, then fats, proteins, vitamins and the minerals are very important for the as a nutrition. In nutrient generally the daily intake of the food or nutrition, as you observe here the nutrient quantity per day. So energy about 8700 kilocalorie, then proteins 50 grams, fat 770 grams, carbohydrate 310 grams, sugar 90 grams, sodium 2.3 grams, dietary fiber 30 grams and saturated fatty acids 20 grams. So here as the we are knowing the carbohydrates, they are the most abundant organic molecule on the earth. The carbohydrates are defined as a aldehyde or the keto derivatives of polyhydric alcohols. For example, glycerol on oxidation is converted to the D-glyceraldehyde, which is a carbohydrate and derived from the trihydric alcohol, glycerol. So we are observing how the pathways are there. Then all carbohydrates have the general formula. It's N, Cn, H2n and ON, or it can be rewritten as Cn, H2O, like this. So this is the general information for the carbohydrates. Then in classification of carbohydrates, they are mainly classified into these four: monosaccharides, disaccharides, oligosaccharides and polysaccharides. Monosaccharides, good example erythrose, ribose, glucose. Disaccharide example sucrose, lactose. Oligosaccharide example maltodextrose, and the polysaccharide example starch, cellulose, dextrin and the dextrin. So these are the some highlighting points are there. Then while we are considering for the metabolism, so in the metabolism, as we are knowing, there is the having the major part of this particularly there are the thousands of chemical reactions are there, and these chemical reactions, they are generally taking place inside the cell in an organized, well coordinated and the purposeful manner. All these reactions are called as the metabolism. So whatever chemical changes takes place in the cell, generally it is to be having the well defined. Then in the types of metabolic pathways, the catabolic, anabolic and the amphibolic pathways are there main. There are three stages: primary, secondary and the tertiary, right? So just you remember the highlighting. Then as while we are considering, if we are taking the food molecules, so simpler molecules, they are divided into two: amphibolic pathway and amphibolic into two, anabolic and the catabolic pathway. So anabolic pathway, it gives to the proteins, carbohydrates, lipids, nucleic acid, and the catabolic, it gives the carbon dioxide and the water development. In the anabolic pathway, there are these cycles are there. So glycolysis, then citric acid cycle, gluconeogenesis, then glycogenesis, then glycogenolysis, then hexose monophosphate shunt, then uronic acid pathway, the lactose pathway, fructose pathway, and the amino sugar metabolism. So these pathways, these are the main 10 pathways are seen in the anabolic pathway. The glycolysis, firstly, it is given by the EM, also called as EM pathway or embedded Meronov pathway. So the photograph of this scientist, it is given. So glycolysis is defined as the sequence of reactions converting glucose or the glycogen to pyruvate or the lactate, and with the production of the ATP. So how the ATPs are produced? So this is the one part is there. Here all we are knowing the clinical aspect of these are there. So lactic acidosis, so it is normal value 4 to 15 milligrams per liter. Then mild forms strenuous exercise, it's shock or respiratory disease and in cancer. Then it serves for impairment, collapse of the circulatory system, myocardial infarction, pulmonary embolism, and the uncontrolled hemorrhage and the severe shock. Then cancer glycolysis. The cancer cells increase the uptake of the glucose and the glycolysis, and the blood vessels unable to supply the adequate oxygen. So therefore hypoxic condition develop, anaerobic glycolysis, hypoxic glycolysis, and involvement of the hypoxic incubable transcription factors. So just you remember how is this flow sheet is there. Then in the second citric acid cycle, as it is also called as a Krebs cycle, and in the Krebs cycle, as we are knowing, there is having the main part is there. Here while we are going to consider the essentially involve the oxidation of acetyl CoA into the carbon dioxide and the water. Secondly, as the cycle utilizes about the 2/3 of total oxygen consumed by the body. Here you see the table, the brief historical characters are there. So in the brief historical characters, Hans Adolf Krebs, 1937, the studies of the oxygen consumption in the pigeon breast muscle. Then location of the TCA, the mitochondrial matrix in close proximity to the electronic transport chain. And overview, 65 to 70% of the ATP is synthesized, and this TCA used because at the outset of the cycle tricarboxylic acid participate, right? So tricarboxylic, so therefore it is called as a TCA cycle, right? Then nextly, as this flow sheet, so how the changes are there. So pyruvate is converted to the acetyl CoA, NADH is developing first molecule, then it develops acetyl CoA, CO2 gets released, the citrate forms, citrate to the isocitrate, again here CO2 release, NADH develop. Then there is a alpha ketoglucarate, so this is the fourth step, again CO2 and NADH develop. Then succinyl CoA, it is the developing from this one, again phosphorus, GTP and GDP, the succinyl CoA is giving to it to develop the succinate. So this is the sixth step, and in the seventh step, FADH2 FAD, it developed to the succinic acid to the fumarate. So after fumarate development, the again NADH develop, to maltate, and maltate converted to the oxaloacetate. So like this cycle is going to completing here, and so therefore it is called as the importance of glucogenesis, or it is related with the citric acid cycle or tricarboxylic acid or the TCA cycle. So you remember this simple flow sheet. Then in the glucose formation, the importance of glucogenesis, it carries the weightage. Here we are knowing the applied aspect of TCA is the mitochondrial encephalopathy occurs due to the fumarase deficiency, and it is a mitochondrial myopathy affecting both the skeletal muscles and the brains are there. In relation to the importance of glucogenesis, as we are knowing, the brain central nervous system, the erythrocyst or testes, and the kidney medulla dependent on the glucose for the content supply of energy. Under anaerobic condition, the glucose is the only source to supply the skeletal muscle. Occurs to it. The basal requirement for the body for the glucose is fasting for even more than a day, and effectively clears certain metabolites produced in the tissues that accumulate in the blood. So there are some treatments given, and therefore this pathway is given in our syllabus. Then Cori cycle is there, so it is seen in the liver. So fatty acids gives to the CO2 and H2O, and there it's develop the gluconeogenesis. Glycogen develops release, and it passes to the muscles. Glucose glycogen, and the cycle involving the synthesis of glucose in liver from the skeletal muscle lactate, and the reuse of the glucose thus synthesized by the muscle for the energy purpose, and it is known as the Cori cycle. So from liver muscle to liver and liver to muscle. Then about the glycogen storage diseases are there. So here you are observing the table. There is a type 1, type 2, type 3, type 4, type 5, type 6, type 7, type 8, like this one. So we'll see one by one. So type 1 is there, von Clerk's disease. So glucose 6 phosphate deficiency. Clinical features are there. It shows hypoglycemia, enlarged liver and the kidneys, and gastrointestinal symptoms are there. So nose bleed, short stature. Then in second stage, Pom's disease, acid maltase deficiency. So it is diminished muscle tone, heart failure, and enlarged tongue. Then type 3, Cole's disease. It shows the debranching enzymes deficiency, hypoglycemia, enlarged liver, then cirrhosis, then muscle weakness, and the cardiac involvement. In type 4, Anderson's disease, branching enzyme deficiency, so enlarged liver and spleen, cirrhosis, then diminished muscle tone, possible nervous system involvement. Then type 5, Murdel's disease, so muscle phosphorylase deficiency, so muscle weakness, fatigue, and the muscle cramps are there. Then there are the different enzymes effects are there. So type of enzyme and this one. So in the type 6, Hirsch disease, so liver phosphorylase deficiency. It shows the mild hypoglycemia, enlarged liver, and the short stature is there. Then type 7, the Tarrell's disease, the phosphoproteinase deficiency, muscle pain, weakness, and decreased endurance. Then type 8, it shows the liver phosphorylase kinase, so mild hydrogenesis, enlarged liver, short stature in the childhood, and possible muscle weakness is there. The liver glycogen, hypoglycemia, possible liver enlargement is there. Then in mucopolysaccharides, the MPS 1, MPS 2, MPS 3, MPS 3B, 3C, like this. So depend alpha L. So what are the changes are there in the carbohydrate pathway? So we are observing. So mental retardation, then other diseases like macroglossia, retinal degeneration, then in type C Hunter syndrome. So it is due to the indoronate sulfase, mental retardation similar, and this type acceptability. So here you are observing these are the MPs, mucopolysaccharides, right? Then MPs defeat and the symptoms are there. So MPs IVA, IVB, then I 6 and the 7 and the 9th, right? So here the galactose, G sulfatase and beta galactosides, they are developed, then beta gluconide, and they form the certain symptoms are there: severe skeletal dysplasia of the short stature, motor dysfunctioning, then severe skeletal dyspepsia, then short stature, right? So hepatogaly is there, skeletal dysplasia. So different conditions develop in our body. Then in metabolic hormonal mechanism, so role of hormones in the carbohydrate metabolism. So here the maintenance of this blood glucose level. So here liver, then extra hepatic tissues, and the hormones plays the important role. Here you are observing this photograph of the generally how the hormones are related to this condition, right? Then basically role of carbohydrates in dental caries. So fermentable carbohydrate causes the loss of caries resistance, then process interplay between the oral bacteria, local carbohydrate, and the tooth surface. So bacteria plus sugar plus teeth, organic acid develop, and it carries develop. Then role of carbohydrate in periodontal disease. So abnormal glucose metabolism then causes the diabetes mellitus, and the periodontal disease is there. Excessive carbohydrate intake, obesity, and the periodontal disease. So mainly due to the sugar, the obesity means disease of the eyes are developing. Then role of thyroid hormone is there. It stimulates the glycogenolysis and gluconeogenesis. So hypothyroid and the hyperthyroid. So fasting blood glucose is lowered. Then patients have decreased ability to utilize glucose, and patients are less sensitive to insulin than normal or hypothyroid patients. The fasting blood glucose is elevated, and the patients utilize glucose at normal or the increased rate. So these are the some characters. Then other hormones and the hyperglycemia, hypoglycemia. In hyperglycemia, thirst, dry mouth, polyuria, tiredness, fatigue, blurring. So it is in glycemia, mood change. Then sweetening in hypoglycemia, sweetening, trembling, prouding, anxiety, hunger, confusion, speech difficulty, incoordination, etc. So these conditions develop due to glucose conditions, right? So then secondly, other hormones are there. So growth hormones, anterior pituitary hormones, or they elevate the blood glucose level, antagonize action of the insulin. Then growth hormone is stimulated by hypoglycemia, decrease glucose uptake in the tissue. The chronic administration of growth hormone leads to the diabetes due to the B cell exhausted. Then cystic fibrosis, it means CMD. So in CMD, in cystic fibrosis is characterized by high rate and the lateral course. the CMD have the retarded the physical development more pronounced morphofunctional disorders, right? And the carbohydrates are the major source of the energy for the living cells. The glucose is the central molecule in the carbohydrate metabolism, and which actively participating in a number of metabolic pathways. One component of our dental caries, etiology of dental caries, the carbohydrates which act as a substrate for the bacteria, and they effort the reduce sugar intake. So this is all about the carbohydrates. So in the summary of carbohydrate metabolism, as we are knowing, carbohydrates, glucose, mainly they shows there is having these cycles as glucose, then glucogenesis, glycogenesis, then it gives pyruvic acid, pyruvate, acetyl CoA, citric acid, then it gives electron on right hand side, gives electron transport, ATPs are there, lipogenesis, fatty acids, fats are there. In the protein, amino acids side by side, they are also showing the development of urea, which is utilized by the in this. So this is all about the metabolic pathway of the carbohydrate. In next lecture we will see about the metabolic pathway of the proteins. Okay, so have a nice day. Thanks to all.